really much. Good evening or good afternoon. I don't know where you are based in the world. I will try to bring on the table the vision and the thoughts of a company about the issues to digitalize healthcare system in less developed countries. I will try to share my screen. Okay, I suppose that you are seeing my presentation. And I will try to start another time from some definition. Telemedicine is only one part of the problem. In the previous speeches, we heard about all the different applications of ICT in the management and delivery of healthcare services. I'm outlining that aspect because the complexity and fragmentation of application could be an issue if you think to move all the corpus of technologies and solutions in an environment that is not ready to use, to massively use all those technologies. If we try to simplify, there are three main areas where ICT technologies could improve healthcare delivery. The first area, and I think for Africa it's absolutely interesting, and in general for less developed countries, is the capability to empower patients and citizens. If we bring to the patient and to the citizens the capability to check their health, to run simple diagnostic activity, and to be an active component of the healthcare delivery, probably we are already trying to solve one of the issues in a massive adoption of digital health in less developed countries. The second field where I think it's interesting is the interconnected data set universe. Public authorities, particularly healthcare authorities, can merge and integrate data coming from different sources, from the patient that are empowered, but also from hospitals, from solution provider, and so on. Obviously, fragmentation is a big issue in that activity. The third field where telemedicine and digital health in general could ameliorate conditions in less developed countries is changing the paradigm. The multidimensional approach to care is a new way to interpret healthcare management. Is no more based on the management of acute phase of a disease, but it's following the life of a citizens along all the life cycle, from the moment where it's still healthy to the moment that is following the acute phase or the treatment. In that way, it's possible to offer a more equitable and sustainable access to healthcare services. If we translate such three different big areas in technologies, we need to list an incredible amount of technologies that have to be put in place to be able to offer an equitable access to digital health to every single citizen. And this is the issue. The implementation of all those ecosystems of innovation is difficult, is complex, is so complex that also in more developed countries, we are not able to reach the moment and the phase of development where every single citizen could exploit digital health innovation. There are a lot of obstacles that are explaining that fact. The access condition to infrastructure, the environmental condition, the political strategies and the different policies that are implemented, the cost of implementation, the validation of solution, particularly the validation in a real world environment, the fragmentation Too many different solutions are developed in parallel, and sometimes they are not conceived to interact one with another. So there is a really big problem in the capability to exploit all the advantages. There are issues in regulatory and privacy. From a regulatory and privacy point of view, there is an issue in sustainability. We have to go out of the paradigm of the pilot project. We have plenty of pilot projects, but the real challenge is to overcome all the issues linked to sustainability, to adoption, to cultural reaction, and to be able to offer the possibility for every single citizen to use and exploit the technology. It's necessary to move from the pilot initiative to mass adoption. And we have examples coming from less developed countries. If we think how Kenya was able in the past to implement a really advanced mobile payment system, simplifying as possible the service and making possible for every single citizen with a normal mobile phone to use the solution. If we follow that paradigm also in health, we can expect to stimulate a mass adoption of services. Why that approach is important? Because otherwise, we need to create in every single less developed countries or a continental level a digital health ecosystem. This is the only way to move from a pilot initiative or one niche initiative to a systemic approach to digital health. Obviously, this is complex, this is expensive, it's require a lot of time. And this is the reason why from a company point of view, we have to intervene in all the two set of prerequisites that are necessary. From one side, before to think to adopt in a massive way digital health, we have to solve the social determinants of health. There are some basic problems that have to be solved. Access to services, economic stability, the physical environment, education and culture are key. Why in Kenya the mobile payment system has been a success? Because the young population was already able to use a mobile phone. They were educated from a cultural point of view in using a tool, a digital tool. Food quality and the use of the social network as a positive element of the delivery of healthcare services. In parallel, we need to create the digital prerequisite made of skill, connectivity, device, training, and tech support, keeping in mind that it's not possible to have one single receipt for every single place in the world. So we need to adapt. We need to empower the country or the territory or the society in order that that component of the society will be able to adapt, to personalize the solution to their needs, keeping in mind that at the same time, we need to have a solution that have to interact with other solutions that maybe has been developed in different countries. And if we are able to follow that approach, we can try to analyze the implementation of digital health solution in a different way, starting from the enabling factors that are not only technological, but are cultural, are infrastructural, are linked to the governance system, are linked to the investment, are linked to a different involvement of private company in the capability to create and offer sustainable solutions, are linked to the definition of standard, and using all those positive aspects, we can cope with the barriers, and we can try to customize the different digital health solution with a bottom-up approach, not a top-down approach. And if we are able to do that, we can expect an increasing adoption of digital health solution. Only to give an example, as a company, we interact a couple of years ago with a team came from Cameroon. they were proposing what we call a frugal innovation. They simply developed a checklist that could be used through a normal mobile phone to assess TBC presence in one person. And what they did was simply to standardize the checklist, to validate the checklist with the clinician, to transform the checklist in an app. The app was free of charge, downloadable, and after that, they create a database of physicians. So if someone doing the checklist will identify the risk to be affected by TBC in an automatic way using the GPS of the mobile phone, a list of physicians was presented, making easier for someone to understand the diseases and to contact a physician. But there is a second step. The second step is to add an artificial intelligence engine, able not only to analyze the data, but to rank the data through a validated checklist and to suggest different kind of physicians in order to the degree of danger. And that example, I think, is quite interesting because the first solution was really simple. It was something that everyone in a less developed country could use, or at least the majority of the person. The penetration rate of mobile phone in Africa, we know a little bit better Africa, is impressive. The second version is more complicated, but the second version will arrive when the first version will be adopted. The first version will become an integral part of the normal way that people is doing self-assessment for TBC or for other respiratory diseases. The inventor made also a version for COVID. So that example, I think, is quite paradigmatic. We have to be aware that if we bring too complex solution, it will be really difficult to reach a critical level of adoption. If we start with innovation adapted, that could be part of the cultural change, we can expect an increasing adoption rate and, last but not least, the sustainability of the solution going out of the pilot project. Thank you.
Thank you very much, Dr. Conicella. Thank you for